Okay, so posterior to the foramen ovale, that's the foramen ovale. Look at the foramen ovale. Posterior lateral to the foramen ovale is a foramen spinosum. The foramen spinosum transmits the middle meningeal artery and the middle meningeal artery, as well as the meningeal branch of cranial nerve number 5. Now, it is important to note that the middle meningeal artery is a branch of another branch of the maxillary artery. The maxillary artery has approximately 15 branches. We made mention of one of the branches, which is the accessory meningeal artery that passes through the foramen ovale. And now we're seeing another branch of the maxillary artery, which is the middle meningeal artery, that passes through the foramen spinosum. Like we said before, if you look at this, you would see the artery, the vein, all right? This is the artery and the vein as it exits, all right, through the foramen spinosum, all right? That's the foramen spinosum. It runs on the floor. This is the outer table and this is the inner table of the skull. It runs on the floor, the periosteum of the floor of the cranial cavity. It is covered. So let's see. This is the, we're going to use this to describe the meninges. Now, the meninges are coverings or protective coverings of the brain. There are basically 3 types: the dura mater, the arachnoid, and the pia mater. However, the dura mater is of 2. We have a tough, fibrous dura mater, which is described as the periosteal dura mater, and the other one is the meningeal dura mater. The periosteal dura mater, this is the periosteal dura mater, this is the meningeal dura mater. So if this is the periosteal dura mater, this is the meningeal dura mater. Okay, I am going to lay this right now on the floor of the skull. I'm laying it right now on the floor of the skull. So you see that? In real life, there's no how you can separate the periosteal dura mater from the skull. You cannot snatch it out. However, now remember that the artery we're talking about, which is the middle meningeal artery, that has 2 courses. It has an extracranial course, so it passes, right? This here we have the maxillary artery. So the maxillary artery gives a branch that drives into the cranial cavity through the foramen spinosum to get into the cranial cavity. However, it runs on the floor between the periosteal dura mater, that's the periosteal dura mater, and this is the meningeal dura mater. So it runs between the floor of the body of the periosteum of the skull and the periosteal dura mater. Now, when a person receives a blow by the side of the skull, usually this bone here, where you have the confluence of or intersection of these 4 bones, the temporal bone, the sphenoidal bone, the frontal, and of course the parietal bone, forming this portion here called the terion. This cracks, and when it cracks, because this artery is running on the body of the floor of where you have the terion, the jagged edge of this bone that cracks will lacerate the middle meningeal artery, specifically the anterior branch of the middle meningeal artery ruptures, And when that ruptures, the blood begins to leak, begins to pour out, and forms a bulge, which is a hematoma. And this hematoma is called epidural hematoma. Epidural hematoma is that hematoma that exists when the middle meningeal artery ruptures and leak out blood between the space between the floor of the periosteum of the skull and the periosteodural matter. Okay, now that is very important to note. Now finally, we're going to leave the middle cranial fossa, and then we go to the posterior cranial fossa. That's the posterior cranial fossa. Very prominent in the posterior cranial fossa is this large opening here, which is the foramen magnum. The foramen magnum will transmit, let's take it as the foramen magnum transmits the medulla. So it receives the medulla of the spinal cord, or the medulla is one of the parts of the brainstem, and inferior to the medulla is the spinal cord. So the foramen magnum, which is this, will receive the medulla oblongata. It also receives the vertebral arteries, the anterior and posterior spinal arteries, the dural vein, as well as the accessory spinal nerve. Let's take that again. The foramen magnum will receive the following structures. It receives the medulla. It also receives the spinal arteries, posterior and anterior spinal artery, the dural veins, the accessory spinal artery and nerve, and vertebral artery. Okay, now you have here on this bone here, look at this bone here. Let me take this off. All right, that's the mandible. So that bone here, right, this bone is called a pitchers bone. That's a pitchers bone. The pitchers bone is a very hard bone that houses and protects the inner ear as well as the middle ear, the middle and the internal ear. On the rostral side of the inner side of the pitchers bone is the internal acoustic meatus. Here is the external acoustic meatus, and this is the internal acoustic meatus, and I hope you can see that. So the internal acoustic meatus will transmit facial nerve and vestibular cochlear nerve. Facial nerve is nerve of facial expression, and also supply anterior two-thirds of the tongue, special sensation, anterior two-thirds of the tongue. So it's a mixed nerve. It has a motor component as well as a sensory component. The vestibular cochlear nerve is a combination of two nerves that has the function of hearing and balance, the vestibule and the cochlear nerve. All right, now here we have the jugular foramen. The jugular foramen transmits the jugular vein. It also transmits cranial nerve number 9, cranial nerve number 10, and cranial nerve number 11. Cranial nerve number 9 is glossopharyngeal nerve. Cranial nerve number 10 is vagus nerve, and cranial nerve number 11 is accessory nerve. Now, cranial nerve number 9, being a glossopharyngeal nerve, will innervate muscles, the pharyngeal muscles. All right, so it's a motor nerve. It has a motor component, and as well as sensory, because it will sensory modalities sent from the posterior third of the tongue, all right, to it is sent from the posterior to third of the tongue to carried by this nerve. And we also have the glossopharyngeal nerve, which will convey sensory modalities from the salivary gland to ganglion, of this nerve. All right. So the parotid nerve, the parotid gland, I mean to say. And so that's it. And here we have the hypoglossal canal. That's the hypoglossal canal. The hypoglossal canal will transmit the hypoglossal nerve. The hypoglossal nerve is a complete motor nerve that's responsible for innervation of muscles of the tongue. All right. Now, this is how much we can take for this video. If you have any question, you can ask me, and you also subscribe to my YouTube channel. Thank you very much. Have a good day.